Hello, everybody. So today we're going to be continuing our talk about Native American health, and we're also going to be looking a little bit into how that plays into what we call historical trauma, and we'll talk a little bit about that as we get to it, and how historical trauma was created by a different factors that affected Native people throughout history. One of them, one of the big ones, is the boarding schools. We're going to spend a little bit of time looking at bits and pieces of videos, and I think one of the reason why I'm showing short clips of videos is because I'm not necessarily a health professional, but it's something that really needs to be addressed within Native American studies, and that is that the health of a community, any community, is leads to the health of a nation. And we're talking about physical health as well as spiritual health, and I'll explain a little bit about that and understand that what I'm not trying to do is to preach to anybody. What I'm doing is I'm just explaining to you how it is that we look at health, and in order to be a fully healthy person, how Native people look at it. I mean, focusing on Wabanaki because we talked about that throughout the semester, and this is something, obviously Wabanaki is what I'm familiar with, but I do think that there are other tribes, obviously, in the United States, Canada, all over the world actually, that have health that concerns and reasons for ill health that may be related. But again, this is going to focus on Native American health. So what does Wabanaki health require? Well, without good physical or spiritual health, one cannot have good mental health. So you need a good physical and a spiritual health in a healthy sort of way, in that you're physically fit, you're spiritually fit, and we'll talk a little bit about what that means, what I'm talking about, what it means, and that can lead to good mental health or poor mental health if you have the reverse of that. So mental health obviously is everything you see in this stock photo here, which is what you have the ability to do things like cope, to be showing emotions, positive or negative, anxiety, disorders, health disorders, stresses. So there's all these different things that can lead to a poor mental health. They also can lead to a good mental health. And so how do we kind of round that? How do we realize that? How do we figure that in our lives? Okay, so we have an ancient way of doing this, a way that was prehistoric as far as history goes, again, and a contemporary approach. And why are some of the negative mental health issues sort of generated or passed down? And why is it that Native people can't get over it, per se? We'll talk a little bit about that, and we'll address some of those issues. And again, I think some of these videos, clips that we're going to be showing, will address those issues as well, better than I can explain them, at least. So let's start off by talking about PMS. And of course, the three most important aspects of Indian health are PMS. And that's the physical, so your physical health, you take care of your body, your mental health, to take care of your mind, and your spiritual health, to take care of your unseen other half. We call it a spirit, and we'll be talking about that in the sense that spirit is your unseen other half. It's the energy that keeps you going. And again, this is, just keep in mind that I'm not preaching to you about this. I'm telling you how Native American see spiritual halves. So of course you did know that PMS meant physical, mental, and spiritual. That hopefully got your attention a little bit, so that we can get on with what it means. So here is a diagram. Okay, so here we have two people, obviously male, and to each person, let's just take the one on your left. You see the human, the flesh color, and then you see behind the human there's a sort of a scattered, see-through, translucent sort of blue person, and behind that blue person is sort of like a gold person. So let's look at these just for visual and imagery's sake as the three things that exist within one person. So you could picture that this gold human form is walking into the blue form, which is walking into the flesh form, and it will create one form. So the flesh colored form obviously is your physical, and I do understand that not everybody looks like this with their six-pack abs and their lack of genitalia, but apparently this is a very safe picture. And keep in mind that the physical, if the physical is in good shape, like, you know, very healthy, you eat very healthy, you're physically healthy, very little or none in regards to health problems, then we believe that 50% of you that you see, the flesh, is good. Now we know that not everybody can be living at 100% physical capacity. So we don't look at it as 100% physical capacity. We look at it as 50% because that's what you're seeing. You're seeing the 50%. Then there's the unseen, the spirit, which stands behind you. So the spirit is standing behind the physical. Now the spirit, it has to be healthy as well. So in other words, we're taking care of our spiritual side, where we pray, we honor the days, the objects that come into our life, the things that we receive that we take for granted, like water and food. So the spiritual half is that in which you can't see. It's the energy that keeps us going. So together, this spiritual and physical halves create a person. And what you see when you look at another person is you only see their physical. And of course you can tell if people are depressed or people are anxious, or they're not in good shape physically. If they're not in good shape physically, they're probably not in good shape spiritually. But if both are in good shape, then you have good mental health, this gold figure standing behind everything. That's the mental health. And together they create an unseen half, the other half, the half beyond the flesh. And I know this is a concept that's sort of hard to explain and probably hard to understand, but just understand that one's physical, one's spiritual, and one's mental. And together they create either a healthy or a mediocre healthy or an unhealthy human. So you need to have a strong spirit and a strong body to have strong mental health. So what does it mean? Well, family, that's your whole health. Now, family does not necessarily have to be your blood. Family can be what you define it as. It's your inner circle. So you're standing in a room, and you're in the center of the room. There's nothing else that exists in that room. You're in the center. You are the thing that has to be taken care of. You take care of yourself. You have to take care of yourself physically, emotionally, spiritually, and that's from that you can help others. And then there's a circle of people standing around you, shoulder to shoulder. You're still in the middle. They're facing you. They're standing around you in a circle. And those are the people that you consider family. That means that you would basically tell them anything that you need to tell them. You feel comfortable with it. You feel safe. They're people you rely on. They rely on you. And outside that circle of your family is another circle. And outside of that circle, another circle. So it's starting to look like a target, like a dartboard. And the further out you go, the less connected you are. You might just be acquaintances. You might work with somebody. You might not have any connection with them other than that. But as the circle gets bigger and it expands outward, you become less and less attached. And so they become less and less what you consider family. Because family, yes, they can be biological, they can be blood, but there are many people in this world who are not blood related, or who don't look at blood relations as someone who they can consider family in that respect. So to have that family, to have that support around you, that's whole health. Ceremonies and ritual are part of that. And for Native people, contemporarily, it could be church, it could be ancient tribal ceremonies, whatever it is. Family gatherings, those are all ceremonies or rituals that create that whole health. And that's why I say contemporary and or traditional spiritual practices are important and needed. Because again, if we don't take care of our spiritual, our physical is weakened. Therefore, our mental is weakened. Our mental health. We have songs or social family gatherings, social community gatherings, and knowing who you are important. Knowing what your community is, knowing yourself. And that doesn't necessarily mean knowing your ethnicity, knowing your history. It's knowing who you are. That's important. And a lot of times in this day and age, we tend to know who we are. We always know who we are, but sometimes we question it. And when we start questioning it, we start becoming, put into a place where mentally we're being who we are or being what somebody else wants us to be instead of being comfortable with ourselves. So knowing who you are is important. And again, that can be religiously, that can be politically, that can be physically, spiritually, that can also be sexually, and those are all things that we're supposedly allowed protection of in this country, supposedly allowed to have the freedom to be that. But society judges differently. And so sometimes we block that. Sometimes we don't want people to know what our religion is. We don't want it to affect them negatively, or our politics, or our sexuality. We don't want people to know that stuff. So we try to breathe somebody else, and we try to just go with the flow. And sometimes that can just wear down on people, and it wears down on people around you and can create unhealthiness. So one man's myths and legends are another man's stories. And so we never take a person's story and say, oh, that's a myth or that's a legend. We never do that. It's wrong to do. It's judgmental. So we always got to keep in mind that one person's story is maybe not another person's story, but it's not necessarily a myth or a legend, as those two words have a connotative and denotative meaning to. So there's a little clip here that I want to show you. It's about a 4-minute some odd clip, and it talks about Indian Health Services, which I obviously, as I look at this, I misspelt. But Indian Health Services, IHS, is what provides health insurance or health services for Native people. So I'm going to show two videos. I'm going to show this one, which is sort of like one that some medical students put together to explain Indian Health Services. I think it's one of the better ones. It's easy. They really are low budget. They kind of do everything on a whiteboard and use cutout pieces of paper, but I think it really helps get the point across. So we'll look at this video and we'll talk a little bit about it afterwards. So here, listen to this.
The Indian Health Service, or IHS, is a federal program that provides free healthcare to Native Americans on reservations across the country. Many people have heard of the IHS but do not know why or how it was created, so let's start from the beginning. In 1492, Christopher Columbus made his first trip and landed in the Bahamas. European colonization soon followed, bringing centuries of hardships for Native Americans. Disease, displacement, and warfare nearly wiped out the entire Native American population. In 1788, the U.S. Constitution gave the federal government the exclusive power to pass laws regarding Native American commerce and land, stating, "The Congress shall have the power to regulate commerce with foreign nations and among the several states and with Indian tribes." The United States Congress used that power to systematically and forcibly reduce tribal lands to the current 55.7 million acres, only 2.3% of the area of the United States. In the process of displacement, the U.S. government signed many treaties with tribes promising services like education and health care in exchange for tribal lands. Treaties include the 1744 Treaty of Lancaster, establishing the Appalachian Mountains as the boundary between the settlers and Native Americans, making room for the original 13 colonies. That was followed by the 1830 Indian Removal Act, signed by President Andrew Jackson to remove Native American land rights east of the Mississippi River. Then came the discovery of gold in the West in the 1860s, leading to massive migration of European settlers to the West Coast. Finally, in 1887, the Indian Allotment Act gave Congress the authority to establish Indian reservations, reducing the tribal lands even further and creating the system of reservations we still have today. It was not until the 1921 Snyder Act that the promise of health care was put into congressional law. It states, "Congress may from time to time appropriate for the benefit, care, and assistance of the Indians throughout the United States, for the relief of distress and conservation of health, and for the employment of physicians." In 1955, providing these services became the responsibility of the Indian Health Service, now a division of the Department of Health and Human Services. The IHS currently services 1.9 million Native Americans with 31 hospitals and many more health clinics. But the IHS is no longer the sole provider of healthcare services to Native American tribes. In 1975, Congress passed the Indian Self-Determination Act, which gives tribes the authority to take over social programs, like health care, that were once run by the federal government. Tribal governments are given the power to customize the healthcare services as they see fit to provide for their population's unique needs. Currently, 33% of hospitals and 83% of health centers on reservations are run by tribal governments rather than the IHS. The last major change came in 1976 with the Indian Healthcare Improvement Act. It increased funding to improve the provision of health services, construct and repair facilities, increase the retention of healthcare professionals, and provide more access to health services for urban Indian people. Congress has not reauthorized the Indian Healthcare Improvement Act since 1992, contributing to many current funding problems within the IHS and health disparities among Native Americans.
Okay, so that's pretty self-explanatory in that giving us a good outline, a good rundown of how Indian Health Services came into existence. And I think one of the things I want to show you now is basically how it works in different states. So I found this video about how Indian Health Services run in Oklahoma. And Oklahoma has a huge amount of native population, and so what they did in this report is they interviewed some Indian Health Service folks, and they also interviewed the tribes and went to an IHS clinic. And you'll get a little bit of a taste of basically how tribes do this, and realizing that, like it stated in the other little video we just watched, was that tribes have a right to regulate how they do this. And one of the things is that, or a misnomer is, that we get everything paid for as Native people. We get all our health care paid for. We get free everything. It's not true. And this little video here that I found, I think explains a little bit more in depth about how it's taken place in different states. And I think you could look at this in Maine. We have 5 Indian Health Service clinics, and you can see through this video basically how we run ours as well, but there was nothing put together that explains it in Maine, so this was the only one I found. So let's look at this one.
The Affordable Care CARE Act has prompted debate over the need for government-directed health care. For decades, the government has run health care systems for military veterans and also Medicare and Medicaid. And the Indian Health Service provides care for thousands of tribal members in Oklahoma.
So she's 14 months, Mom?
Yes. Charlie Kay has the sniffles and a cough. Her mom, Shelley Wani, traveled from Morris to Tahlequah so she could be seen by a doctor at the Cherokee Nation's Hastings Hospital.
Yeah, she sounds a little bit congested, Mom.
Charlie was born with Down syndrome, and we just loved her doctor. He took such great care of her, and that's why we continue to drive an hour and 15 minutes to come.
Wani's family falls into one of the big cracks in the traditional healthcare system.
We didn't have insurance.
Because her husband is a Creek tribal member, the family qualifies for Indian Health Services. Treaty obligations require the federal government to provide health care for Native Americans. Carmelita Wamigo Skeeter is CEO of Indian Healthcare Resource Center in Tulsa.
We serve Indian individuals no matter what their income is. They do not have to pay to come for these services.
Skeeter says half of Oklahoma's 39 federally recognized tribes operate healthcare clinics and hospitals. The Cherokee Nation runs the largest Native American healthcare system. Bill John Baker is principal chief.
If all we did was rely on what the federal government allowed for health care in Oklahoma, we wouldn't meet 40% of the need.
So Indian healthcare systems blend healthcare funding they get from the federal government with other resources to cover the cost of providing care. It works like this. If patients have medical insurance, Medicaid, or Medicare,
we do bill Medicaid, Medicare, and private insurance.
Baker says the Cherokee also put 5% of the profits from their casinos and tribal businesses toward health care.
We've had to be very proactive and put our money where our mouth is to not only collect insurance and private insurance and Medicare, Medicaid, all third-party pays, but we've actually put our money with it so that we can better serve our people.
Many tribes and Indian healthcare providers also solicit grants and donations from foundations and corporations.
Your needs are so broad that no agency can meet all those needs. And I don't believe that our government would ever be able to meet all those needs. You have to have a blend. You have to have the private sector involved. And you have to have the corporations and the industry involved.
Well, I miss it to you, sweetheart. Blending resources allowed the Indian Healthcare Resource Center to grow from a single volunteer doctor a couple of decades ago to a sprawling clinic offering services ranging from OB and pediatric care.
Any new concerns? No.
To outpatient clinics for adults covering everything from regular checkups to diabetes management and mental health services.
The robot fills the bottles.
The center has a state-of-the-art pharmacy with automated dispensers capable of filling up to 1,000 prescriptions a day. There's also a full dental clinic. But Skeeter says this facility, as well as other Indian healthcare clinics, sometimes have difficulty providing patients with certain services.
I believe our biggest problem today is funding to see specialists. And that is the biggest expense because we can take care of the primary outpatient services here in the facility. But when we need a specialist or specialty care, then the funding for that care is very hard to come by, particularly if you don't have Medicaid or Medicare or private insurance.
Skeeter and Baker say tribal healthcare systems make every effort within their budgets to provide the most and best care possible. Indian health systems don't want to be regarded mostly as providers of last resort for indigent or uninsured Native Americans.
We've got to be the provider of choice so that our Cherokee citizens that have insurance, we've got to do a good enough job to attract them to come to our facility so that we can collect their insurance, so that we can help take care of the ones that have no insurance.
Connie Davis is Executive Director of Health Services for the Cherokee Nation. She says providing a high standard of care does more than attract patients that can pay part of the bill.
Something the public is beginning to hear right now is about reimbursement toward hospitals, value-based purchasing. And hospitals are paid based on how well they take care of cardiac patients, congestive heart failure patients, pneumonias, and many surgeries. And for years, the government has expected those kinds of performances from these tribal hospitals and facilities. And Cherokee Nation has exceeded those expectations across the nation and actually leads in the GEPRA scores for all other tribes.
GEPRA, or GPRA, stands for Government Performance Rating Act. Hastings' GEPRA score and high volume of patient visits are signs more and more Native Americans with insurance do select Indian healthcare systems as their provider of choice.
This facility here was built in the early 80s. It was designed for 30,000 patient visits, and we saw over 300,000 patients in this facility last year.
So planning is underway for a major expansion of the hospital. The Affordable Care Act will be fully implemented in 2014. The Indian healthcare system could provide a template for how healthcare will operate under the Act.
With more people with insurance, then less private hospitals, less city hospitals will be giving, not billing for services. And so I think they'll get more lean and mean, but at least if they get the basic care covered, it ought to be for better health care for everybody.
2 government healthcare systems are teaming up to give Native American veterans better access to health care. The Department of Veterans Affairs will now reimburse Indian Health Services for providing care for Native American veterans. The agreement between the VA and IHS aims to improve access to care for Native American veterans, especially those living in rural areas.
So essentially what you're seeing and what you can hear, and I think hopefully what you understand, is that the Indian Health Service clinics run really no different than other clinics in the country because of the fact that they take insurance. So for instance, I go to the Indian Island Health Center, and I work at the University of Maine, and I have University of Maine insurance. So I have a choice to go wherever I want, to see whoever I want, as far as a primary health provider. I choose to go to Indian Island because we have good dentists, we have good doctors, we have good mental health specialists, dietitians, and I think where there I can get everything sort of met as far, and we do have a pharmacy. I can get all my needs met there, and it's close, and I know everybody, and it just feels more comfortable, but the quality is just the same. And if I do need a specialist for something that the clinic can't do, then obviously they'll refer me out, and that bills my insurance as well. And some of the people that don't have insurance that my insurance helps are usually elderly or those who retired. Most of the Native people in the clinics have health insurance. Now, what the government allows, and they didn't mention this in here, but what the government allows for money for Native Americans is the federal government pays $3,000 a year for each tribal member. So if you have 2,000 tribal members and they're paying $3,000, the government's paying $3,000 a year for each one, then that's how much the funding is for that particular clinic. And if there are more people, obviously, then the clinic has to try to figure it out, and this is where the tribes kick in some monies that they have from economic developments as well. And just for an example, if you're homeless in the United States and you go to a hospital or a clinic, the federal government allows you $9,000 a year. That's how much is allocated per homeless person. So it's actually health-wise a little bit smarter to be homeless than it is to be Native American. So there's really no advantage there at all. So now I really want to kind of move on a little bit past that, because we're still in the idea of looking at the health aspects of a whole body. And so there are some things that are important to understand, and one of them is called historical trauma. Now, I think this clip that I'm going to show you here is a 2-minute clip, and it's just a woman explaining to you, what it is to her that she feels like why she's angry all the time. And not all the time, but I guess, when she gets angry, she attributes it to something, and she doesn't know why she's angry. Just feels angry. And worldwide, this idea of historical trauma, can be measured in your DNA. Really, it can be handed down. Trauma can be handed down. You think that like diseases like schizophrenia, or even some cancers, or other sort of neurological or mental disorders are handed down. That's proven. And lately it's coming around that historical trauma, which I realize I spelled trauma wrong here, is also something that can be handed down. So let's just listen to this little video clip.
That's a song that was counting dead Indians back on the trails when they would kill Indians.
See all these little kids in uniform, and we'd be wondering how come they're like that. We weren't dressed like that, but these little kids were.
I remember being younger, growing up on a reservation, and being told, don't trust white people, don't listen to them. Never told why.
The government schools are constantly being built and hospitals added. We bring them in, clean them up, and start them on their way to civilization.
I would ask social services and human services audience, how many people know about residential boarding schools? How many people here do? This never makes it into the history books. This is never talked about.
Why did those schools get started, and who started them, and what was the rationale behind it?
The first general policy was the only good Indian was a dead Indian, that we needed to be killed, exterminated, eradicated. Once they realized that's a little bit more difficult to do, is to have mass genocide of a population, the policies changed from killing to killing the Indian and saving the man. There's a General Pratt who was well famous and documented for using those words to kill the Indian and save the man, and that we are subhuman, and that our ways are savage, and we need to be civilized. Well, and the governments in Canada and the United States followed that policy up until the 1980s in one form or another.
There is a boarding school far, far away where we get mush and milk 3 times a day. Oh, how the huskies run when they hear their dinner bell. Oh, how the huskies run 3 times a day. Like I say, I went to the mush hall when I was 4 years old. I was there for 9 years, and once in a while we'd come home on summertime, but not all the time. When the counselors came and told my dad that he couldn't raise us properly, we were at the mush hole 1 week and our heads were full of bugs.
Well, there was a lot of sad times, but I mean, like, I didn't get like angry and have any resentment until after I got out, because I didn't know, like, from 5.5 to 16, I just thought it was just like a normal upbringing, like to not have no parents and stuff like that. So that's and after I got out, and then they thought, well, this is the way they were supposed to be treating us.
I think my mother couldn't take care of us because our father was into alcohol. Me and my sister, we started there in 1945. I was 5 years old at the time.
We had all our hair cut off. We were made baldies. We were really bald. And that wasn't a very good feeling to have. And they used to call us mush hole baldies. That's what the kids on the reserve used to call us.
Well, we can go in now. I mean, this is going to take like all day, eh? Jesus.
We were taken to the hospital to get checked out for nits and whatever, I guess that was, you know. Well, they checked us out, you know. Then they split us. The school was split in age group and by the boys and girls. Boys were on one side, the girls were on one side. And they went from the lower age up to high school level.
My mom was going to walk out here and go to the store. And at 5.5, my sister tells me that I grabbed my mom's leg, and you know, of course we were all just crying. The whole four of us were just crying, like, you know, because my mom was going to leave us here. So I grabbed my mom's leg and well, crying and that, and just kind of like hollering like, "Ma, don't leave me," like, you know. So, but anyway, like while that was going on, like the supervisor came over and just kind of grabbed me and took me off my mom's leg, and then my mom just walked out, and I never seen her for those 10 years that I was here. She never come to see me once. I don't know why.
He took my brother away to where he was supposed to stay, and my sister, she just went on her own. I was with most of the 4 and 5 year olds. We didn't go to school because we were too young.
Yet, through the agencies of the government, they are being rapidly brought from their state of comparative savagery and barbarism to one of civilization.
When we used our language, at that young age too, you know, we were just learning. So they used to wash our mouth out with soap. They would take the whole bunch of us and march us to the shower, coal shower, and they'd throw us in there and beat us along the way. And that was a routine thing, I guess, I don't know. But that taught us, you know.
They'd throw us in this dark press room where they kept all our Sunday go-to-meeting clothes, and they'd throw Rosemary and I in there and tell us the rats were going to get us. But I didn't know then why I was being thrown in there, and I used to wonder, what did I do? And I would cry, and Rosemary would cry, and we cried and cried for hours in there, not knowing why we were in there. And they'd take us out. And when I did get to learn a little bit of English, I knew then they were throwing us in there because we wouldn't speak English. And I must have been stubborn right from the day I was born, because I thought to myself, I'll never speak English either. You want me to speak English? I won't speak English. So I didn't speak at all for 2 whole years, because I figured if I spoke Indian, I'd get a licking. And if I spoke English, then it would be against everything that I stood for. And so I didn't speak at all.
But today they all speak English, and some have taken business courses, home economics, and other higher training.
Took us into another room down there, and maybe down in the playroom, we took all our clothes off and we put the clothes of the school on. Yeah, and they give us a number. So my number was like 48, and my brother was 36.
My family was the state-run institute, and the nickname for the Thomas Indian School is Salem. And Salem was derived from asylum. And you know what an asylum is. It's for crazy people. So we were thought of as being crazy, I guess.
They were just considered bad people, bad children, but they weren't bad children, okay? They were placed there for so many different reasons, but not because of any kind of delinquency on their part.
So this was part one of two parts, and I misintroduced this video, but I didn't put all the video up because it's kind of long. But I wanted you to really get an understanding of what these boarding schools have done to people, and we saw that these boarding schools, either children were dropped off there because parents couldn't take care of them, or the children were taken by the schools because the school felt they couldn't take care, people couldn't take care of their own children. So however they got there, and whatever happened, but it doesn't go away. It doesn't make it better. And in the Northeast, there are boarding schools as well, or there were, I should say, and most of the ones that were in this area were closer to St. Stephen, New Brunswick, which is across from Calais on the border. There was also one in St. John's, New Brunswick, and a lot of them have been converted into hotels. For instance, the Algonquin by the Sea in St. Stephen is New Brunswick is a former boarding school. So these boarding schools were reused later on, and a lot of them became illegal when the American Indian Religious Freedom Act was passed in the 70s, and so the schools saw it coming, so some of them closed down before that actually hit them. So anyway, we could see that, but I think this next, apparently I didn't even put it in there, the historical trauma video. So oh, maybe it is, and I just didn't, hold on a second. Let me just see. Okay, here we go. So yeah, let's just look at this this one. I don't know how I passed it, and hopefully I hopefully I didn't show it already. But I think I might have passed it by mistake. I think this was the one I was talking about that was spelt wrong, and I introduced it properly, but somehow passed through it. Yeah, I did see it's going, keeps going backwards. So let's try this again.
Problems controlling my anger. Can't really think of just one time. I know most of my anger comes from pain. Someone once told me the reason I have so much anger is from my dad, and it comes from my grandpa, which comes from his mom. That the anger is pain from so long ago. She says Indians are so full of pain, causes them to drink it all away, but instead it causes more pain. I have anger from pain. I have many generations of built up pain. I hope that I can learn to forgive and heal, so I no longer carry the pain of my ancestors. I will forgive. I will heal.
1.5% of the U.S. population is Native American. Historical events such as removal from homelands, sexual abuse, exposure to violence, boarding schools, massacres, forced relocation, homicide, suicide, and multiple victimization are ways in which trauma has affected Native communities. 40% of Native Americans live below the poverty line. 39% have some form of a disability. Native children have 2.5 times greater risk of experiencing a trauma, and 30% have some form of depression, while 10% have PTSD. The suicide rate is 3 times higher for Native Americans. Native American women are 2.5 times more likely to be raped or sexually assaulted than women in the U.S. in general. Native Americans are 2.2 times more likely to have diagnosed diabetes.
So that summed up that little clip pretty well. And sorry for the jumping around on the slides, but that was pretty much it. So this is what I wanted to talk about as far as when we look at health and we look at Wabanaki mental health, in that we look at this from different angles and different cause and effects. And the purpose of this particular sort of lecture today was to look at cause and effects, like to look at how, first of all, how we have good health, how we could have good spiritual, mental health, physical health, and what takes away from that historically within Native American societies, and what the United States purposely ignores as far as their history goes, as far as a democracy. And I mentioned before that, you know, the United States is a democracy. It likes to call itself a democracy, but it wasn't even until the 1920s that women could vote. That is really, in essence, of what a democracy is about, is not a democracy. Also, until 1977, when Native Americans couldn't, it was illegal. It was illegal to speak our language and to practice ceremonies. We didn't have religious freedom. Hence, the American Indian Religious Freedom Act was passed. So, without these sort of approaches, we can call ourselves a democracy as a country. We can always do that. We always will do that. But there are certain aspects of democracies that really don't show a healthy democracy. Government also needs the physical, the mental, and the spiritual as well. And so doesn't the education system, and so doesn't the healthcare system. So all these different approaches really play into who we are as tribes. And that's why I thought it was important to show you at least a little bit of a capsule around how Native Americans view our health, how we view our community health, and how we view our health in our relationships with our governments and our education systems as well.